Hi everyone, I'm Ashley Moss. I'm a pediatric psychologist with the Diabetes Clinic at Seattle Children's Hospital and assistant professor at the University of Washington. Today's talk, we're going to be discussing helping kids with diabetes management at school. This is the first of a two-part series focused on behavior management and helping kids cope with self-care at school. After diagnosis, transition back to school can be overwhelming for children, families, school staff, and nurses. An adjustment to diabetes management tests at home and school can come with very different emotions for children. As a part of this talk, we'll be focusing on setting children up for success with diabetes management at school. This includes setting expectations and clarifying roles, setting up a routine and coping plan, utilizing effective communication skills with children, and integrating behavioral management strategies. One of the first opportunities we have to set children up for success is using the diabetes medical management plan to help kids understand what is going to happen at school and who will be responsible for what. The diabetes medical management plan also provides us with an opportunity to revisit children's capability and competencies for diabetes management school over time. For young children less than age 5, this might include doing things like choosing which finger to poke or what injection sites they want to use for their pre-bolusing. As children develop, they might be able to take on more independence, such as checking blood glucose, giving themselves insulin with supervision, and all of these things can evolve with time. Regardless, providing children with the opportunity to control their environment increases their sense of self-efficacy and mastery, and helps them predict what's going to happen. Another strategy for setting kids up for success is establishing a routine. Routines are important for kids regardless of their age because it provides predictability and helps build trust between adults and students around their diabetes management. By helping kids understand what they will be doing in school to care for their health, who will be involved, and when they will be taking part in cares are important components of creating a routine. Asking for students' involvement in the development of their routine can also help increase their sense of control over management at school, and this can be done as a part of the diabetes medical management plan. That being said, we want to recognize that it's not possible for us to predict all circumstances and all outcomes. So building trust with children might also involve helping them to be prepared for the unpredictable by talking to them about circumstances or situations that happen less often. For example, a nurse is out sick and there might be somebody else who has to take care of them, so introducing them to this backup person can be helpful. Helping kids develop a unique coping plan is another useful tool for both kids and school nurses. Coping plans help kids and adults know what to do and what their options might be when their emotions like feeling overwhelmed, anxious, or even upset get in the way of diabetes management at school. They also provide adults with an opportunity to understand students' preferences. Things like, what kind of distraction do they like? Is it listening to music, watching something, reading or talking? And maybe it's even doing things like squeezing a fidget or doing something with their hands, as well as their preferences around seeing management tasks being completed. All of these really give us opportunities to gauge kids' preferred coping strategies, and if they use other coping strategies like deep breathing. Engaging both caregivers and students in these conversations also provide us with an opportunity to learn about and problem solve around potential challenges with behavior or big emotions that might be happening at home that could be happening at school. Another important strategy for setting kids up for successful diabetes management at school is effective communication strategies. And we're just going to touch on a few of these here. So one is related to telling kids what to do rather than what not to do. Oftentimes we find ourselves telling kids things that we don't want them to do rather than what we'd actually like them to be doing. So an example might be if a kid is wiggling around on the table or if they're whining. Saying things like stop moving doesn't really tell kids what to do. The options are kind of endless. If they can't move, does that mean that they could hit, scream, kick? Probably not. That's probably not what we're wanting kids to do. Instead, we might be telling kids, it's really important for you to sit still and keep your bottom on the table so that I can give you the shock quickly, and then we can be all done. Doing this gives us an opportunity to tell kids explicitly what we want them to do so they know exactly what needs to happen. It also gives them an opportunity for praise for preferred behavior. Showing children behaviors through modeling or through visuals. Some kids, especially younger kids and kids with developmental delays, really benefit from pairing verbal information with some sort of visual or pictorial representation or behaviors that are being modeled by the adults taking care of them. These things together can help aid in kids' understanding about what is expected of them. So going back to the idea of a child being wiggly, or maybe they're swinging their legs or kicking, showing a picture about what it means for a kid to be still or sitting on their bottom. Which again ties into our third and fourth points, which is that children do best with clearly and simply stated instructions using developmentally appropriate language. All of these things decrease the risk for confusion for kids and increases the opportunity for compliance. Finally, last piece is really bringing encouragement, enthusiasm with specific focus on preferred behaviors. All of these things increase the likelihood of future preferred behaviors and success with diabetes management. That really lends us into the next section where we're going to be talking about the basics of behavior management at school. A common challenge faced by adults in children's lives is how to handle kids' behaviors, especially those that have been interfering with diabetes management. And we can use principles from operant conditioning to help shape kids' behaviors through positive and negative reinforcement and punishment to make diabetes management go a bit more smoothly. So let's briefly go through what's meant by positive and negative reinforcement and punishment. So first we'll focus on the positive and negative pieces. So positive refers to something being added to a child's world, and negative is the opposite, something being removed or taken away. Reinforcement is something that increases the likelihood of a behavior happening again in the future, and punishments are designed for decreasing the likelihood of a behavior to happen in the future. So we can put all four of these concepts together to really understand the ways in which our behaviors in response to other children's behaviors might impact the likelihood of future behavior. So let's start with positive reinforcement. Positive reinforcement is where something is added to increase the likelihood of behavior in the future. So an example might be a child gets praise from a parent for good school grades. That increases the likelihood that a child is going to keep working hard to get good grades, and their parents are going to provide praise, and that helps them feel good. Another way we think about positive reinforcement is through the use of rewards. And oftentimes there's confusion between a reward and a bribe. So rewards are intentional, they're typically pre-planned, and they're used to reinforce or increase the likelihood of preferred behaviors and should be given when we see something that we like and we want more of in the future. It results in increased likelihood that that's going to happen. Bribes, on the other hand, are typically done in the moment, oftentimes driven by our emotions like desperation and really feeling the pressure to get things done. The problem with bribes is that they oftentimes unintentionally reinforce or increase the likelihood of non-preferred behaviors because the kid received something that feels good, that's positive or enjoyable for non-preferred behaviors. So that kind of brings us into negative reinforcement. So negative reinforcement is where something is removed in order to increase the likelihood of a behavior in the future. So the example here is a child cleans their room to avoid a nagging parent. Negative punishment is something where we remove remove something in order to decrease the likelihood of a behavior in the future. An example might be a child losing an iPad privilege for refusing to eat their vegetables or sitting down to dinner with the family. And then the final one, positive punishment. This is where something's added into the child's world that decreases the likelihood of a behavior in the future. So an example might be a parent scolding a child for fighting with their sibling. So let's think about these different things with examples of diabetes and diabetes management. For positive reinforcement, as you can imagine, child is able to sit still, you're able to kind of clean their skin with an alcohol swab, give them their injection. It's done quickly. And so we might say like, wow, that was awesome. You did a great job sitting still. We got it done. And now you get to go play with your friends. Have a really good time at recess. All of those good, positive labeled praises help kids feel good about themselves, and it increases the likelihood that they're going to do things like sitting still and engaging in behaviors that help them get that praise from you. A negative reinforcement might be kind of similar to the example, a child checks their blood glucose to avoid someone nagging at them to do so. Positive punishment, an example might be adults scolding a child for maybe not engaging in certain management tasks or behaving in a way that might delay management tasks or arguing about management tasks. And while that is meant to decrease a behavior, it might actually increase some resistance for kids. The other problem with this is that it unintentionally reinforces adult scolding behavior, meaning in order for a kid to be able to engage in their management tasks, they need to be scolded by an adult. Clearly not a great situation to be in. And then the final example of negative punishment might be losing an iPad or technology time for not engaging in certain diabetes management tasks. Or for a kid at school, it might be they lose access to recess because they did not comply with diabetes management tasks at school fast enough. Of the 4 strategies that were just reviewed, it's probably not surprising that positive reinforcement is the most highly recommended, because we want to increase the likelihood of preferred behaviors in the future. So this means finding as many opportunities as we can to do things like praising preferred behaviors, doing things like positive labeled praise, where we're telling kids specifically what we liked and what we hope to see more of in the future. Same example that we've brought up throughout this talk, thinking about like, oh wow, you held still, you stayed on your bottom, you had calm and quiet legs, you're able to keep your feet to yourself. Being able to explain exactly what kids did that you liked will help increase the likelihood of them being able to continue to do it in the future. For some kids, especially younger kids, creating some sort of behavior tracking system or report cards can be used as a visual representation for tracking preferred behaviors. And that can also be used as a communication strategy for helping work with parents to recognize what their kids are doing well, especially at school. And it can help kids feel good about the things that they're achieving at school as well. Even things as simple as giving a high five and telling them why you're giving them a high five helps them understand again what they did well and what they can do again in the future. And again, hearing you talk about how proud you are about their achievements and things that they've done also help kids feel really good. A special note on non-preferred behaviors. So sometimes children demonstrate behaviors that can be frustrating or annoying for adults, but they don't necessarily interfere with the task at hand. So an example might be a child whining about diabetes management or having to have a finger poke or an injection in the nurse's office. And oftentimes kids are scolded or told to stop in these kind of circumstances. And while the scolding is meant to decrease the behavior, it might actually increase the likelihood of this behavior in the future because of the attention that was given to it. So it shifts from a positive punishment towards a positive reinforcer. The alternative is to ignore the behavior, ignoring the annoying behavior that's not interfering with diabetes management, and reinforcing the preferred behavior using the strategies like positive labeled praise. So rather than utilizing positive punishment for the non-preferred behaviors, we're really focusing in on providing that positive reinforcement for the ones that we want to see more of. Ignoring should not be used in situations where behaviors are unsafe. So an example might be a kid is moving around a lot while you're trying to administer an injection. Leaning on the effective communication strategies that we spoke about earlier, like telling kids what you need them to do, in this case, sitting still, paired with our attention and using things like labeling preferred behaviors as soon as we see them, helps reinforce the preferred behavior of sitting still. So putting it all together, we reviewed a number of different strategies and skills during today's talk. We discussed providing clear expectations and role delineation for kids, setting up a routine and creating coping plans, as well as utilizing effective communication skills for children when they're at school around their diabetes management. All of these different things together help support our efforts to set kids up for success. And it also sets us up as adults in kids' lives by helping us know exactly what we're looking for to be able to reinforce in the future in order to make management tasks go as smoothly as possible. Thank you very much for joining, and hopefully I'll see you at part 2.